What is up, healthcare professionals? Logan here with Healthcare Stress Relief, and in this video I'm going to be talking, of course, about burnout, but in particular I'm shooting this video something you can send to your administration when you go into their office and you're honest with them. You tell them that you're stressed out, burning out, and they just kind of scoff and write it off and tell you that they need you. So send them this video, let them know what's up. When I was working as a new grad, we had like 10 new graduates who were training on the ICU floor, and we needed a lot more resources, but the administration would not provide it. And the CEO of the company was under the mindset that he could just keep hiring new grads every year in order to just keep the costs down of the hospital. But what he wasn't looking at was the bond between the coworkers and the efficiency that was going to happen and the better patient care by having a collective unit that's a team was going to save the hospital way more money in the long term. But he wasn't looking at that. He was just crunching numbers. So the big thing you can tell your employer, I'm going to go through a list right here, is the cost of burnout, having burnt out employees, is going to just destroy the business. Here, just a list of some of these things. So it causes high rate of employee turnover. So all of your coworkers are going to be quitting, which is going to make the team bond even worse. Decreased employee satisfaction, increasing employee absenteeism. If you're burnt out, you're just going to be, let's wait for this car to pass. If you're burnt out, you're just going to be not wanting to show up to work anymore. Increasing employee complaints, increasing customer complaints, decreasing the quality of products and services. I had some burnt out coworkers, and the patients would often turn them around the next day and say, I don't want them again. You could tell which nurses were the ones that would not get the same patients because they were just very jaded and kind of robotic, because they're just over it. Increased hostile or toxic work environments. I've seen this firsthand. Lots of bullying and stuff going on with the burnt out coworkers. The older ones in particular will just basically make the new grads lose all hope. Nurses eat their young mentality. Not something you want when you're a new graduate, and it's not something you want when you're a senior nurse and you have new grads coming in. If you treat them like crap, they're going to perform worse, and the whole entire environment is going to be worse off. So it's up to administration to start implementing things that are going to make the employers less burnt out. Increasing lawsuits, more mistakes, more lawsuits. That's going to cost your company a lot of money. There was a mistake made in my hospital in the emergency department where I believe they sent a patient home too soon, and it ended up costing them like $3 million in a lawsuit. They lost, and the patient died. So and then less sales. You're not going to have as many people come into your hospital. Your Yelp reviews are going to be terrible, 1 stars all day. So go ahead and send this to your administrator so they can review what the cost of burnout is to the hospital. And stay tuned on my channel. I'll be going over all the ways to reduce burnout, but I'm reading this book, Reignite, by a guy, I can't remember his first name. His last name is Gaither. But basically, he puts it on the employer. He says like 90% of burnout is actually caused by the system and not by the employee. But with that being said, the employee still has to develop tactics and tools to decrease their stress if their administrator is not going to start to make changes. And I hate to say it, but the world is the way the world is, and there are a lot of people who aren't going to make changes for you, so you're going to have to make the changes yourself. If that means learning new tips and tricks, or leaving to go to a different department, or leaving your hospital completely, that's a choice you have to make. But you can make those steps as long as you're empowered. And in the programs that I have right now, I'm teaching nurses tactics, tips, tricks, tools that they can use for the rest of their life so they can maintain their career in the long haul while they have somebody to support them. So if you're interested in that, click the links below. And you guys best be staying strong in the hospital. I will talk to you later.